Welcome. I'm very excited to be here today, and we're grateful to Ori and Sonia for giving us the opportunity to talk about our work. And we are Magic of VRX. Where's the clicker? Excuse me.
Today we're talking about creating awe, the miracle of VR with cancer patients.
I'm Teri Yarbrow, and I'm the president of Magic of VRX and also of Creating Awe. I'm a professor of immersive reality at Mercer Medical School. I'm a founding member of the American Medical Extended Reality Association, and I encourage you guys to join. I'm also a former professor of immersive reality at SCAD, where I developed the VR for Good program, and that was a program working in conjunction with Hospice of Savannah and the Steward Center for Palliative Care, in which students made incredible projects in a 10-week period, and we took them to patients. Furthermore, I'm an Emmy award-winning ProMax Telly Award multimedia artist, and I've worked as a LA-based creative director. So, but VR has become my passion, and I'm a VR evangelist.
I'm Max Almy. I'm co-founder of Magic of VRX and founding member of Creating Awe. That's our new project, our new venture. I'm the former dean of the School of Creative Technology and Digital Media at SCAD, which is a giant, amazing art and design university. That was a wonderful experience. I was a dean there for like 7 years. But before that, and actually while I was there, we created the first immersive reality BFA in a creative university, which was stunning. And Teri actually helped design that program. I'm also an Emmy award-winning creative director, but before that I was a crazy video artist and then working in all kinds of forms of art and media and art and technology. That's been my forte my whole life. And so along with all these things, I'm a futurist, and I'm also a passionate VR evangelist.
I wanted to mention that the work that we're going to discuss today has been done in conjunction with Dr. Kathleen Benton, who is the CEO of Hospice Savannah and also the CEO of the Steward Center for Palliative Care. And this work is in an I.R.B, which we'll discuss a little later. But the reason I got excited and interested in medical VR is very personal. I was with my mother when she had her transition experience. I was in hospice with her, sleeping in the facility that she was in. And this was at a time when we didn't have VR. And consequently, there was nothing. I mean, we could control the pain, yes, but it was profound because she waited for a pastor. She waited for a rabbi. Nobody came. And the reason that nobody came is that the people that are providing pastoral support are stretched far in between. So there's very little comfort care, spiritual care for end of life. And when she transitioned, I realized we could do so much more, and that really motivated me to get involved in this space. Virtual reality has been called an empathy machine by Chris Milk, the godfather of VR, or one of the main godfathers of VR. But from working with palliative care patients and hospice patients, I've discovered it's so much more. It's a device for delivering compassion. It's also a tool for evoking awe. And I think that we can do just so much more in this space. What if we could shift the way a patient relates to their illness? What if we could shift the way somebody relates to their mortality? Studies have shown that it takes someone 30 seconds to accept a simulation, right? So we can hijack the brain. If somebody is in bed and a hostage to their bed, we can transform their experience. We can take them out of their bed, we can take them swimming with dolphins, we can take them to a light shower, and the point is we could transform their relationship to their diagnosis. That's what the miracle of VR is with cancer patients.
The World Health Organization came up with a definition for palliative care. It's treating the patient holistically. And it actually states palliative care improves the quality of life of patients and that of their families who are facing challenges associated with life-threatening illness, whether it's physical, psychological, social, or spiritual. And that's what we want to talk about today, the three aspects, physical, psychological, and spiritual, and how we can improve that care.
And we improve that care by inducing awe.
What is awe? Awe is the feeling of being in the presence of something vast that transcends your understanding of the world.
So this is based on a quote by Dagner Keltner. He's one of the foremost researchers into awe, and he's a psychologist at the University of California at Berkeley, and he's written a lot of the seminal books on awe. He defines awe as a category of self-transcendent experiences, or STEs. Awe evokes a cognitive shift in perception. It's also, once one has experienced awe, you're never the same, right? So it calls for accommodation on the part of the ego. You cannot be the same person once you've had a profound experience of awe.
The overview effect has been described by astronauts looking at space, from space, looking at the planet Earth, and really creating a powerful shift in the way they think about the Earth and life. Awe is something we've all felt at some time or other, and it can be induced by being in nature, looking at a great artwork, listening to amazing music, in a spiritual or religious experience, and everyday miracles like looking into the eyes of a newborn baby. You want to move forward? Yeah. The medical benefits of awe are really specific. They've been totally researched and documented. New studies reveal it is critical to our well-being, just like joy, contentment, and love, and has incredible health benefits. It can calm down our nervous system. It releases the hormone oxytocin, which promotes love and trust. It silences the inner critic, the default mode network. It activates the vagal nerves, the clusters in the spinal cord, and therefore you get goosebumps. It slows down our heart rate. It relieves digestion and deepens breathing.
I love this slide. This is a fMRI of the part of the brain where awe occurs. So I can say clearly, it's not a woo-woo emotion. That's a medical term, by the way. Anyways, awe is considered a profound and complex emotion, and it's at the core of change, and it's at the core of transformation. And numerous studies are showing that VR is at the core of transformation. So researchers are using VR to induce awe to measure where it happens in the brain. I want to just take a moment because we saw a panel this morning that talked a little bit about the history of VR, and they showed a little bit of this, but I just wanted to mention what this is about. Snow World, and this is what interests me. Snow World is the work of Hunter Hoffman and David Patterson. It's from the 90s at the University of Washington, in which they created a game where they put burn victims in an environment of snow, and all you had to do was shoot snowballs at penguins and listen to Paul Simon music, very chill. And they were able to do wound care on third-degree burn victims from the Iraq War. This became the foundation of distraction therapy, but it also gave birth to the gate control theory of limited attention. Now, what that means is if you stimulate the prefrontal cortex of the brain, you're in an immersion, and it doesn't have to be VR, it could be extreme sports, it can be anything that is totally immersive for you. But in any case, if you stimulate the prefrontal cortex, your brain puts up a neurological gate, and pain receptors can't get in.
In addition to reducing pain, virtual reality can quiet the default mode network. This is part of the brain that is always watching, always critical. Reducing DMN activity can alleviate the anxiety that plagues so many patients. Silencing this inner critic can open the door for an experience of awe.
I love this slide as well because this was given to us by Hunter Hoffman. This is his work. The top visual shows This is somebody's brain in a pain episode, and you can see all those areas lit up. The bottom slide is showing, with VR, look at the reduction in pain. So here's my thesis. If the gate theory says that you can put up a neurological gate for pain, why can't we do the same with psychological pain? Why can't we do the same with spiritual pain, which we observe with so many of our patients? So we're using VR to induce awe in our therapy. And what I want to say is David P. Yaden, he's a leading authority on awe, and he's from Johns Hopkins. And he's been using VR to generate awe in the lab to measure where in the brain it's occurring. And he says that VR is a particularly effective mood induction tool for eliciting awe. But I'm saying we could take the same approach and elicit awe for our patients and have a profound effect. So what we're going to show you now are some, bless you, some case studies in which we're going to show the profound effect of awe in the lives of cancer patients. And this comes out of a study that we've been doing for 3 years. It's an I.R.B. with the Steward Center for Palliative Care and Joseph Candler Hospital in Savannah. And the results of this study are coming out in a book that I'll tell you about at the end of our talk. But I wanted to show you some of these miracles with VR and cancer patients. This is Roberta. Her name has been changed. She's a stage 4 pancreatic cancer patient, and she's debilitated and depressed, and it's Christmas time, and she's also a minister at her church, and she feels like she's useless. She can't go to her church and do her work because she has cancer. So this is her first session with VR, and it evoked a profound sense of awe for her. I think the photo kind of sells it. And it restored a sense of what she already knew. I had the opportunity to work with her a number of times in the pain clinic. She came a number of times for a tune-up, and each time we did awe-inducing VR experiences. This is a patient with extreme anxiety. She's just received a diagnosis that she has stage 4 cancer, which is metastasized. And she's been described by our clinic as, is a medical term, she's a hot mess spiritually, physically, and emotionally. So this patient came in with her eyes wild, very nervous, really upset, crying, and I call it marinating in her diagnosis. Why me? And kind of getting a loop going. I've got cancer, I'm not going to get better, I'm going to die. And we proposed VR to her as part of her treatment. She joined our trial, and she went in our session from being incredibly depressed off the scale with her anxiety and pain, which we were able to bring down to 0, and she left our session wanting to buy a VR headset or take it home with her. So VR had induced awe for her, and this is another example of the miracle of VR with cancer patients. This is Tom, suffering from pancreatic cancer, and he has tremendous anxiety. He's afraid he's going to die in his sleep, and he's a very thoughtful individual. Oftentimes, a VR therapist is somebody that just listens, right? You just hold space and let the patient vent. Oftentimes, a VR therapist can be somebody that's a healer or a shaman or just somebody that administers a VR headset. In this case, he watched a number of meditative experiences, and then he watched Radiance VR, which is a program that Max and I and Josephine Leong created. It's you're standing in a shower of light. And he did it 3 times, and at the end he said, I'm not afraid to die. I no longer have anxiety. This is what a near-death experience must be like, and it evoked a sense of awe for him. This patient is just a real sad story. This is a woman that has stage 3 fallopian tube cancer, and it's come back, and she's really suffering under her own self-judgment. Her default mode network is working overtime, telling her that she's at fault for having cancer, that she's a burden to her family. So she came to the clinic suicidal, not wanting to live. She had expressed this to her oncologist, who sent her to the Palliative Care clinic, thought maybe we could help her. And so we did some VR in addition to listening to her. And as a result, her mood transformed. And she was able to go from an anxiety level of 10 down to 4, but she really stressed, wouldn't it be incredible to have a virtual reality in an infusion center, right? Infusion center, I don't know if you've ever walked through them, but people are on their cell phones and they're watching daytime television. It's a pretty toxic environment. So she had 6 rounds of chemotherapy and said, wow, if I could have had VR, I could have been somewhere else. I could have transformed. This is the last case study I'll show you. This is Bart, and he's been given a prognosis of 3 years to live. He's in his 4th year, and he has diminished lung capacity. He can't breathe. His lungs have dropped to 43%, and when I first started working with him, he had just experienced a 15% drop. So he suffers from anxiety that he's going to suffocate in his sleep. And he also has anxiety that he knows he's going to die. His first experience with VR was incredibly profound. He was able to relax into it, and also he said that he felt the light of the VR going straight into his chest. So let me just play this video for you. Let's see if I can get it.
I can feel it coming into my chest. It's really very effective.
It's not going to repeat, sorry. One thing I wanted to say about Bart is that he could return to this state of awe just by remembering the music and the visual he saw. So he had a very transformative experience. I'm still working with him. He's still alive, and he's recently bought an Oculus. Not that I'm pushing Oculus after seeing HTC in the last session, but yeah, he's bought his own headset to give himself therapy.
Palliative care and hospice can be a profound time in the life of a patient and their family, and it can be a vehicle for awakening. Elizabeth Kubler-Ross, a Swiss-born psychiatrist, researched the end-of-life experience and famously identified 5 stages associated with grief in her book On Death and Dying. These stages have been defined as denial, anger, bargaining, depression, and acceptance.
But from the work I've been doing, I say we can add another step to this, and that would be transformation. Because if we can transform somebody's experience towards their diagnosis, they can have a transformation psychically or spiritually or even physically sometimes. In a famous lecture, Ram Dass, the American spiritual teacher and psychologist, he proposed that each of us contain a being that doesn't die and a being that does die. And having that kind of consciousness is an existential crisis that patients are going through.
Research suggests, as we've seen today, that awe is a powerful emotion, and VR can definitely induce it. Whether a patient is immersed in an underwater pod of dolphins or transformed into a shower of light, awe can cause patients to focus on something entirely different than their diagnosis. For someone confined to their bed, immersive VR therapy can deliver an experience that reduces anxiety, relieves pain, enhances quality of life, and can alleviate a crisis of faith by invoking awe and wonder.
Teilhard de Chardin said, "We are spiritual beings having a human experience." Awe-induced VR therapy can be a potent tool to help patients reconnect to this inner truth. So I believe this is what the miracle of using VR with cancer patients are. It's inducing awe. It's helping someone get out of their head and have a much larger experience. I want to do a shout out. All the study, the I.R.B. that I've been referencing, is in this book that's coming out in the fall. We are in massive edits right now. It's called Virtual Reality for Serious Illness, and it's written with Dr. Kathleen Benton and myself. We've written a number of chapters, and then we have chapters with a number of authorities in VR medicine. Dr. Brennan Spiegel, who's the head of Director of Health Services and Research at Cedars-Sinai Hospital. He also wrote VRX, how virtual therapeutics is revolutionizing medicine. He's written a chapter. David P. Yaden from Johns Hopkins is contributing another chapter on awe. Dr. Jose Ferrar Costa from Barcelona has written a chapter on doctor and clinician burnout. Sarah Hill from Helium has contributed a chapter on measured mindfulness, collecting biodata, and doctors Anne Zanin, Annie Mercante, and Franca Bernini. They're from the University of Padua. They're going to be publishing their studies with pediatric and VR, and this is coming out from Rutledge.
Well, as you can probably tell, Teri and I are both incredibly passionate about awe and VR, using and focusing on awe with VR. So we're working on this amazing new venture based on all of our experience. It's called Creating Awe, Awe-Inspired Immersive VR Therapy. It's a system of awe-inspired experiences based on our 6 years of experience and proven results in the I.R.B. and more things. Providing relief psychologically, physiologically, and spiritually. It'll be AI-assisted and provide self-empowering interactivity, a sense of fully immersive embodiment, and enhanced with an accessory. I can't talk too much about it right now, but please take a look at what we're doing, and we'd love to connect with you and talk more about this project that we're embarking on now.
So we've saved a couple of minutes for any questions you might have. Yeah?
You did not explain what it is they are watching. That is the intervention. The VR is just the tool. So what are they watching?
Many of them are watching.
And how long?
Many of them are watching a 3-minute loopable experience called Radiance. And one is standing in a shower of light or laying in a shower of light, and you're completely engulfed in it. And it just comes on you, and then it rises up, and it repeats. And it's highly meditative and very centering. Yeah. Yeah.
I'll use the mic. I'm curious, to what extent does music or sound design play into these experiences?
Super important.
It's huge, absolutely huge.
The soundtrack to Radiance is Tom Brennan. He's a really well-known ambient composer, and he's been generous to license.
Donate his work to our work.
Yeah. But we are always looking for incredible, inspired sound design.
And we also know that there's a huge amount of research with audio and state of mind and consciousness and all of those things. So we're definitely exploring that much more deeply in the modules that we're creating for this new project.
Yeah, I'm Leo from Pixelity. Thank you for your presentation, and you ladies are so fair and beautiful, like Cher and Meryl Streep. And my question is, so basically, those rays of light and soundtrack, which is like meditating, actually heal them? What mechanism actually
It
heal them?
contributes to their feeling of well-being. It contributes, I mean, I really believe that if you can do an intervention with a patient that's really very depressed and feeling hopeless, if you can get them to look at something else and look at it for a little bit of time, you can transform their mood. And neurologists know that mood is everything, right? If you are focused on your illness You're focused on your illness, but if you're focused on something other than your illness, something else can happen. Awe can happen. You can get out of yourself. You can get out of your prison of your pain. Yeah.
Thank you.
Okay. Well,
One more.
Hi, thank you. This is wonderful. I'm curious to know, though, is the VR experience, the concentrated experience, the thing that works? Or do you think that, like I'm looking at that picture now, if you were to put the patients in a room with like a great visual, would that work the same way?
I don't think so, and I'll tell you why. The reason that Snow World works, that patients can have wound care done while they're in VR, is they have no peripheral vision. They're completely in the simulation. If you put Snow World on a TV monitor this close to a patient, they could still see the tray coming with, things to apply, the gauze, the bandage wrap, all of that, and that would break the simulation. So really, I think being in a complete simulation is what does it. Yeah, you're not able to see, oh, there's the exit sign, and oh, it's time for my lunch break, and yeah, I'm hungry. All those other factors, it's just completely a focused experience. Yeah.
Hi, my name is Dolce, and I'm a musician, a cellist, and content creator. And just from that process, I mean, you touched a little bit about it, but I was wondering if you could elaborate, like, in terms of your content, there's so many directions, and it's such a delicate matter that you're dealing with. So how do you approach that, and maybe even, well, in the entertainment world, we call it play test, but like test and adjust so that it's effective?
Right. So we go through a process called onboarding with patients, meeting them where they are. So obviously, a patient who's suffering from extreme anxiety and is really agitated, we're not going to put them immediately in a meditative experience. We have to do some segues to get to it. So it's really a question of listening and really trusting your instinct and having a library of content. I have to say that somebody said today content is king or queen, and I agree with that. One of the things that has been discussed is the need for a VR pharmacy, right? That we have a big body of work that if this doesn't resonate with a patient, this will. And if this doesn't work, we try that. But right now, this is like the Wild West where we have a lot of companies and proprietary software, and hopefully someday we'll have a VR pharmacy that we can all share. Yeah. I want to say, you're a cellist? Okay, so
wow,
I just have to segue by saying that we had the opportunity to meet Renee Fleming, who's on a mission from the World Health Organization as an ambassador delivering awe, and that her mission is to go out to schools and hospitals and nursing homes and bring music for healing. I'm getting goosebumps. I'm getting awe talking about it. Okay.
Because it plays such a huge part in the experience, I will say that. It really elevates an experience if you have great music along with it.
Yeah. Anything else? Yeah. Annie.
Yeah.
Sorry.
So I think a lot of us are inspired by this. So what do you need?
We need about 6 months and a bit of dough to put together the rest of what we want to do. We have a kind of a very small beginning.
We have a prototype.
Yeah, that has been super successful. So now we want to really expand it, make it interactive, make it we've got a whole new idea for it, which is, I think, very unique, and I can't really talk about it.
No, that's fine.
And it would be something that we would
Yeah.
license to Mind or Endeavor or Hospice,
And it would
National
be part-
Hospice Association.
And it would be part of that larger library of experiences, in a unique, very new one. So that's what we're working on right now.
Thank you.
Okay. Oops. Thank you. Wow, great.